Hello, my name is Hanin Imad and today we are talking about Leishmania. Leishmania is an intracellular hemoflagellated protozoa. The disease caused by Leishmania is called Leishmaniasis, which requires a vector that is a female phlebotomine sandfly. When the sandfly bites and takes blood meal from the human, if the sandfly is infected with Leishmania, it will inject the infective stage metacyclic promastigote into the bloodstream. This is the bloodstream where red blood cells and white blood cells such as macrophage are present. The macrophage will engulf the promastigote by a process called phagocytosis. However, this promastigote has an enzyme that inhibits phagolysosome biogenesis that eventually prevents macrophage from destroying them. They will remain inside the macrophage and will change its form to become a mastigote, and they will undergo sexual reproduction that will result in many mastigotes until they burst out to infect body organs, mainly the liver, spleen, and bone marrow. Now, when a new sandfly bites a human infected with Leishmania, they will uptake the blood that contains macrophage and a mastigote of Leishmania inside the gut of the sandfly. The amastigote form will convert to procyclic promastigote, and they will undergo asexual reproduction through binary fission. And as a result, it will form lots of promastigotes in the gut, which are now called metacyclic promastigote, and they are ready to infect another human. Leishmania pathogenesis are found in three forms. They are, first, cutaneous leishmaniasis, that is caused by Leishmania tropica, and it is the most common type of the disease. It is characterized by sores on the skin that develops after weeks or months from the sandfly bite. Second, visceral leishmaniasis, also known as Kala Azar. It is caused by Leishmania dinovani, and it is considered most severe form of the disease as it affects the internal organs. It can develop from 10 days up to a year after the sandfly bite, and it is fatal if left untreated. People present with dark pigmentation on the skin, weight loss, fever, hepatomegaly, the enlargement of the liver, splenomegaly, the enlargement of the spleen, and anemia. The last form is mucosal leishmaniasis. It is caused by Leishmania brasiliensis and Leishmania mexicana. It is the less common form of the disease. It can lead to partial or complete destruction of mucosal membranes in the nose, mouth, and throat. It can sometimes occur as a consequence of cutaneous leishmaniasis. In conclusion, Leishmania is a hemoflagellated protozoa which lives inside the blood and has flagella. The mode of infection is indirect as they are unable to penetrate the host directly, and they require a vector, that is the sandfly. This parasite requires two different hosts for the completion of their life cycle, the human as the definitive host, and the sandfly as the intermediate host. This parasite exists in two forms, promastigote that has a long motile flagellum and a mastigote that has a short non-motile flagellum. The infective stage form in human is promastigote, and the diagnostic stage is amastigotes inside macrophage. Thank you for listening. Goodbye.